Welcome to the deep dive. Today, we're really getting into something critical in healthcare, something that maybe doesn't get talked about enough, risk management.
And specifically, its absolutely crucial connection to accreditation.
Exactly. You, our listener, send over some great material. We've got stuff on big international players like Joint Commission International JCI. You hear about them a lot.
Right. And also India's National Accreditation Board for Hospitals and Healthcare Providers, NABH. Plus some, broader takes on what healthcare risk management actually means day to day.
So our mission, really, for this deep dive is to understand why this isn't just bureaucratic box ticking.
Not at all. It's fundamental. It's about patient safety. It's about quality care and that constant drive to improve things in healthcare.
Think of accreditation as that sort of seal of approval.
Yeah, the gold standard? Maybe.
Yeah.
And we want to unpack what bodies like JCI and NABH are really looking for. Why does their stamp of approval matter to you when you need care?
Right, because, whether you're getting ready for a hospital stay yourself or maybe you work in healthcare.
Or you're just someone who wants to be informed.
Yeah. Understanding how managing risks links up with getting accredited, it gives you real insight into the systems that are supposed to protect us all.
Okay, so let's get into it.
Let's do it. So first things first, what is healthcare risk management? Can we boil it down?
Okay, in simple terms, it's basically a systematic process, like being a detective inside the hospital or clinic.
Right.
Constantly looking for potential problems before they cause harm. Yeah. You identify risks, you figure out how likely they are and how bad they could be, and then you put plans in place to try and stop them, or at least minimize the impact.
And it covers a lot of ground, right? It's not just the really obvious big clinical errors.
Oh, definitely not just those, though obviously preventing major errors like, say, surgical mistakes is top priority.
Oh, of course.
But it's also the more common things. Medication mix-ups, infections people pick up in the hospital, things we absolutely want to prevent. Those are the clinical risks.
But you said there's more.
Yes, the non-clinical side is just as vital. Think about your health data. Is it secure? Data breaches are a huge risk now. Or even the hospital's financial stability. If a hospital is struggling financially, they might, cut corners somewhere else.
Which could impact patient care down the line.
Exactly. So risk management takes this wide view, protecting patients and the organization itself.
Okay. And that's where these accreditation groups like JCI and NABH come in. What's their exact role here?
Well, they're the ones setting the standards. Really high standards, usually. For quality, for safety.
So getting accredited by them means a hospital has met those standards.
That's the idea. It's like an external check, a validation that they're committed to doing things well.
A quality stamp you can trust, essentially.
Pretty much, yeah. It shows they've been through a tough evaluation. Take JCI, they're global. Over 20 years accrediting places, I think over 1,000 programs now in 70-plus countries.
Wow.
And their mission statement is interesting. Enable and affirm the highest standards for all. It suggests these core ideas of good healthcare cross borders.
Right.
They do different types of accreditation to not just hospitals, but specific clinical programs, telehealth, even things like healthcare sustainability now.
Sustainability. That is broader than I thought.
Yeah, it shows how quality and safety definitions are expanding. JCI's standards are the bedrock, really, for how places are evaluated. And they focus heavily on their international patient safety goals.
Okay.
Specific problem areas they flagged. And they have this thing called JCI Continuous. It highlights that this isn't a one-off thing. You have to keep improving.
Okay, so JCI is the global giant.
Yeah.
What about NABH? Is it similar but focused on India?
Exactly.
Yeah.
NABH, the National Accreditation Board for Hospitals and Healthcare Providers, it's part of the Quality Council of India.
Right.
Their main job is setting benchmarks tailored for the Indian healthcare system for consumers there. So yeah, JCI is global. NABH is about raising standards within India.
Which makes sense, tailoring best practices locally.
It's a really important trend, actually.
Okay, so we have the standard setters. How does risk management actually connect with getting that accreditation badge? It feels like they have to be linked.
Oh, they are. Very directly. It's not optional. The standards from JCI, from NABH, they specifically require robust, proactive risk management systems.
So it's written right into the rules.
Absolutely.
Okay.
It's a core requirement. They know you can't really have consistent quality and safety without actively managing risks. It's fundamental to that whole culture of improvement.
So a hospital has to prove they're doing this, not just say they are.
Precisely.
Yeah.
They need evidence, real proof that their risk management plan is alive and working. Let's maybe break down some key parts of how risk management fits into accreditation. First, as we said, the standards themselves. NABH, for instance, they require risk management plans for each department, not just one big plan.
Okay. Tailored.
Yeah. And they call out specific risks, clinical ones like infection control, medication safety, but also non-clinical stuff like fire safety.
That makes sense. The risks in the ER are different from the billing office.
Totally different. And JCI is similar. They demand a comprehensive organization-wide program, clinical, non-clinical, and they really hammer those international patient safety goals.
Things like identifying patients correctly, communication.
Yes, those key areas where things often go wrong.
So it's not just having the plan, there's got to be a process.
Absolutely. The process is key. First, you identify the risks. What could realistically happen here?
Right. Yeah.
Then you assess them. How likely? How bad? People use things like a risk register for this.
Like a logbook of potential problems.
Kinda, yeah. A spreadsheet or a database, tracking risks, scoring them, planning actions. Then prioritize which ones need tackling first.
Okay.
Then implement your fixes new policies, procedures, maybe staff training. And crucially, you can't just set it and forget it. You have to monitor. Are the fixes actually working? Evaluate constantly.
Sounds like a loop. Assess, act, check, reassess.
That's a great way to put it. Which leads to the next point. Integration. Meaning risk management can't live in just one office. It has to be like woven into the fabric of the whole organization.
Okay.
Part of how doctors make decisions, how nurses care for patients, how admin runs the place, everything.
So the doctor choosing a treatment thinks about the risks for that patient, and the person buying equipment thinks about financial risks.
Exactly. Risk awareness everywhere. And underpinning all this, especially for accreditation, is that intense focus on patient safety.
The ultimate goal.
The ultimate goal. Prevent bad events, reduce harm, improve care quality. JCI's patient safety goals are all about that.
And you mentioned it's not static. They want continuous improvement.
Correct. Both JCI and NABH expect that. It often follows models like PDCA plan, die, check, act.
Plan the change, try it, see if it worked, adjust based on results.
Yep, that cycle. And JCI Continuous's thing is their formal model for embedding that ongoing improvement idea.
So they're basically saying, prove you're not just good today, but you have systems to stay good and get better.
That's it, exactly. How do you prove it? Documentation and reporting.
The paperwork trail.
Well, yes, but it's crucial paperwork. Records of assessments, mitigation plans, incident reports. It's the evidence for compliance, and it helps them see if things are actually working.
Right.
And incident reporting systems, both bodies, stress these manas. They're vital for building that safety culture, where staff feel okay reporting mistakes or near misses.
Without fear of blame.
Exactly, so everyone can learn.
This sounds like it requires real expertise. Do the people doing this need special training?
Oh, definitely. Healthcare risk management is a specialized field. There's specific training, education, certifications even, like the CPHRM, Certified Professional in Healthcare Risk Management, or CRMP. These show someone has a recognized level of skill in managing these complex risks.
Right. Okay, so we see what it is, how it connects to accreditation, but let's get to the why. Why do JCI and NABH care so much about risk management?
Well, fundamentally, it's because good risk management equals better patient outcomes. It just does.
Fewer mistakes, fewer harms.
Exactly. And it also makes the organization run more efficiently. Fewer unexpected problems means resources are used better.
And we actually have some quotes that back this up from hospitals that went through it.
Yes, some really telling ones. Hong Kong Adventist Hospital said the JCI process really improved teamwork and communication across departments.
So the process itself helped internally.
Yeah, beyond just meeting the standards.
Yeah.
Burjil Farha Hospital talked about gaining a competitive edge, more community trust, but also specifically better risk management and a stronger safety culture from being accredited.
Okay.
Emirates Specialty Hospital saw patient confidence go up after getting the JCI Gold Seal.
Makes sense.
And Cornish Hospital, which has been accredited for ages, sees it as proof of their constant commitment to top-tier care and safety, meeting those international standards consistently.
Those really drive home the point. It's not just about satisfying the accreditors. It delivers real value.
Absolutely. And it ties into the bigger vision these organizations have.
Sure.
JCI talks about a future of zero harm, highly reliable care.
Ambitious.
Very. But they see solid risk management as absolutely essential to even getting close to that.
What about the money side? We focus on safety, but bad risk management must cost hospitals, right?
Oh, for sure. The sources mention impacts on operating margins, on the hospital's brand value.
Right.
Especially now with things like value-based care, where payments are tied more directly to how well patients do.
So if you have lots of safety incidents, it hits your bottom line.
It certainly can. So there's a strong financial incentive alongside the ethical one.
Okay. And you mentioned something called enterprise risk management.
Yes, that's a broader view. It looks at risk across the entire organization, not just clinical safety.
What kind of things does that cover? You said 8 domains.
Yeah, typically 8. There's operational risk, just the daily running of the place. Clinical and patient safety, which we focused on. Strategic risks, threats to the hospital's long-term plans.
Okay.
Financial risks, obviously. Human capital staffing, training issues, legal and regulatory risks. Technology risks, cybersecurity is huge there.
Definitely.
And environmental or infrastructure risks, things like fires, floods, building safety. It's a really holistic view. Like an operational risk could be, say, having old equipment that causes delays.
Got it. That really broadens the scope. So let's make this concrete. How does this look in action? Can we talk through some examples of risk management meeting accreditation standards?
Sure. Let's take infection control. Big area. Imagine a hospital sees its rate of HAIs, hospital-acquired infections, creeping up.
Not good.
Not good at all. So for accreditation, they need to assess why. Maybe they find gaps in how instruments are sterilized. So their fix, their mitigation, might be redoing the whole sterilization process, putting in regular audits, retraining staff.
Right.
If that works, infection rates drop. That's measurable improvement, great for patient safety, and a big plus for getting or keeping NABH accreditation.
Very clear example. How about something like medication errors? That worries a lot of people.
Another critical area? Say a clinic notices errors happening during patient handoffs when one nurse or doctor passes care to another.
Communication breakdowns.
Often, yes. So to meet JCI standards, they might implement several things. Standardize how medication orders are written, less room for confusion. Maybe bring in double checks where 2 people verify a drug before it's given. Better patient education about their own meds.
Okay.
And maybe technology like barcode scanners to match the patient to the drug.
Right.
If those steps lead to fewer errors, that's a huge win and essential for JCI reaccreditation.
And it's not all clinical, you said. Non-clinical risks, too.
Right. Think fire safety. A hospital might need to develop a really thorough fire plan as part of its risk management, maybe for ISO 9001 certification as well.
Okay.
That means installing and testing detectors, sprinklers, having clear evacuation routes, doing regular drills, training all the staff on what to do.
Seems basic but essential.
Absolutely essential. Doing that well shows commitment to everyone's safety and looks good in any external review.
These examples really show it's about practical steps, not just ideas. And the accreditation bodies push for these actions.
They really do. And remember, it's ongoing. JCI does unannounced surveys every, 36 months for reaccreditation.
Oh, unannounced. Wow.
Yeah. Keeps people on their toes. You can't just cram for the test. You have to live it, maintain those standards continuously.
So part of that must be learning when things do go wrong or nearly go wrong.
Absolutely vital. Investigating sentinel events, those are the really serious, unexpected incidents causing death or major harm that's critical. But just as important is capturing the near misses, the good catches. Situations where an error almost happened but was caught in time.
Why are those so important?
Because they often reveal underlying weaknesses in the system. Latent failures, they call them. Things waiting to cause a problem.
Okay.
If you analyze those near misses, you can fix the system before anyone gets hurt.
And technology must be helping with all this now, AI and things.
Increasingly, yes. Technology is huge. Electronic health records can flag drug interactions, for example. And AI. Well, it's starting to show real potential. Analyzing massive data sets to spot risk patterns humans might miss.
Interesting.
Streamlining compliance tasks, managing records better, improving communication, maybe even predicting which patients are at higher risk for certain problems, allowing for earlier intervention.
Fascinating stuff. Okay, we've covered a lot of ground here. What are the main things you think our listeners should take away from this deep dive?
Okay, 4 main things, maybe. First, accreditation isn't just a sticker. It's a tough, ongoing check of a facility's commitment to quality and safety, and risk management is like the engine driving that.
Right, central pillar.
Second, Groups like JCI and NABH provide the rule books, the frameworks that push healthcare places to actively look for and fix potential harms.
They set the direction.
Third, good risk management isn't just about preventing mistakes today.
Right.
It's about building a culture of always learning, always improving, which ultimately makes care better for patients.
Culture is key.
And finally, for you, the listener, seeing that accreditation badge from a known body, it should give you confidence. It signals that the place has robust systems in place, designed to keep you safe.
That's a really helpful summary. It puts those logos we see into perspective. So wrapping up this deep dive, it's clear risk management and accreditation aren't just hoops to jump through.
No, they're fundamental, absolutely essential for making healthcare safer and better quality for all of us. And maybe a final thought for you listening. Next time you're interacting with a healthcare system, think about it. What processes, visible or maybe invisible, are running in the background? Driven by these risk management ideas, by accreditation standards, all working to protect you. And maybe what questions do you feel more ready to ask now? Something to chew on.